The human body operates as a complex, interconnected system, and when one vital organ begins to falter, the signs can manifest in surprising and often overlooked ways. The liver, a remarkably resilient organ with the unique capacity to regenerate, is central to hundreds of essential functions, from filtering toxins to aiding in digestion. Understanding the subtle and unique signals it sends when under duress is a critical step in preventing more serious, irreversible damage. The common assumption that liver concerns are solely the domain of excessive alcohol consumption is a significant oversimplification. In reality, the modern diet, rich in sweetened beverages, processed foods, and an overabundance of certain vegetable oils, can be just as taxing. Frequent use of common pain relievers, exposure to environmental toxins, and certain viral infections also contribute significantly to the gradual accumulation of strain on this essential organ. One of the earliest and most telling signs can be observed in the bathroom. A healthy liver produces and releases bile, a substance that not only helps digest fats, but also gives stool its characteristic brown color. When the liver is compromised, particularly by conditions like fatty liver disease, the production and flow of this bile can become disrupted. The result is often stool that is noticeably lighter in color, sometimes appearing clay-like or pale. In some instances, the presence of undigested fat can make the stool buoyant, causing it to float, which is another indicator of impaired digestive function linked to liver health. Vision, particularly in low-light conditions, might not seem connected to the liver, but is intricately linked. The liver plays an indispensable role in the absorption of fat-soluble vitamins, including vitamin A or retinol. This specific vitamin is crucial for the health of the rod cells in our eyes, which are responsible for adjusting to darkness and allowing for night vision. When liver function is hindered, the body's ability to utilize vitamin A is compromised, potentially leading to a condition often referred to as night blindness, where seeing clearly in dimly lit environments becomes a challenge. This same biliary congestion can also manifest as eye discomfort, including dryness, a feeling of grittiness, or persistent soreness. Fluid retention in the body can also point toward liver distress. When blood flow through the liver becomes obstructed due to inflammation or scarring, it can cause pressure to build up in the portal vein, a major blood vessel. This pressure, known as portal hypertension, can force fluid to seep out of the veins and into the surrounding tissues, a condition called edema. This swelling is often most noticeable in the legs and feet. A peculiar but common observation is that the right foot and ankle may swell more prominently than the left. When you press a finger into the swollen area, it may leave a temporary indentation, a classic sign of pitting edema. The skin around the eyes can also become a canvas for internal health issues. The appearance of small, yellowish, or skin-colored growths on or around the eyelids, medically known as xanthelasma, can be a visible marker of cholesterol dysregulation. The liver is responsible for breaking down and managing cholesterol. When it is unable to do this effectively, excess cholesterol can begin to deposit itself in various places, including just under the skin of the eyelids, creating these benign but telling bumps. Discomfort in the upper right abdomen is a more direct signal. A sensation of pressure, fullness, or a dull ache just beneath the right side of the rib cage, especially after eating, can indicate that the liver is enlarged or inflamed. Furthermore, when the bile produced by the liver becomes thick and sluggish, it can block the small ducts, creating a backup of pressure. This discomfort can sometimes refer to other areas, notably causing tension or pain in the right shoulder, as the nerves serving the liver and that region are interconnected. The body's circulatory and clotting systems are also heavily influenced by liver function. A liver under strain produces fewer of the proteins necessary for blood to clot effectively. This can lead to a tendency to bruise much more easily than usual. You might notice unexplained purple or red spots on the skin, or a rash of tiny, red pinprick-like bumps. These often appear on the lower legs and arms, and are a sign of compromised circulation and capillary fragility, which can accompany liver disease. Even the condition of the feet can provide a clue.
Cracked, dry heels are often dismissed as a simple skincare issue, but they can point to a nutritional deficiency driven by liver needs. Vitamin B3, or niacin, is vital for maintaining healthy, hydrated skin. When the liver is damaged, the body may divert its available reserves of niacin to support the repair processes within the organ itself, leaving other areas, like the skin on the soles of the feet, deprived and prone to severe dryness and cracking. An intense, persistent itchiness, particularly localized to the palms of the hands and the soles of the feet, is another distressing symptom. This is not related to dry skin, but it's instead caused by the accumulation of bile acids. When the liver fails to filter and excrete these acids properly, they can deposit in the skin tissues, triggering the release of histamine and causing a profound, often maddening itch. The fingernails can also undergo changes that serve as a warning. If the nails lose their healthy pink color and become entirely white, or if the tips of the fingers enlarge and the nails curve downward, becoming rounded and club-like, it can be a sign of chronic low oxygen levels associated with significant liver damage. This phenomenon, known as leukonychia and clubbing, was historically noted as a common feature in individuals with advanced liver scarring. Changes in urine color are a very direct indicator of liver function. The liver processes bilirubin, a yellow pigment formed from the breakdown of old red blood cells. A healthy liver filters this bilirubin out of the blood so it can be excreted. A struggling liver allows bilirubin to build up in the bloodstream, eventually being expelled by the kidneys, which results in urine taking on a very dark, concentrated hue, often described as amber, brown, or cola-colored. It is important to note that certain medications, including some antibiotics and pain relievers, can also darken urine by adding to the liver's workload. The most classically recognized sign of liver failure is jaundice. This condition presents as a yellowing of the skin and the whites of the eyes, and occurs when bilirubin levels in the blood become very high. Jaundice is a clear signal of significant liver distress, potentially from hepatitis, advanced scarring, or toxicity, and necessitates immediate medical consultation. Finally, the appearance of spider angiomas or spider veins can be linked to liver health. These are small red lesions with a central dot and tiny blood vessels branching out like a spider's web. They often appear on the torso, face, and arms. Their formation is frequently tied to an imbalance in hormone metabolism, specifically estrogen. A healthy liver helps regulate estrogen levels. A compromised one allows estrogen to rise, which can cause these small blood vessels to dilate and become visible. Observing any of these symptoms warrants a proactive approach, including a consultation with a healthcare provider who may recommend blood tests or an ultrasound for a definitive assessment. The encouraging news is that the liver possesses a profound ability to heal and regenerate, especially when supported through targeted dietary and lifestyle changes. The progression of liver damage typically moves through distinct stages, beginning with simple fat accumulation, advancing to inflammation and scarring, and culminating in cirrhosis. The goal is to intervene as early as possible. The first and most crucial step is a fundamental shift in diet. Reducing the intake of foods that contribute directly to liver fat is paramount. This means cutting back on sugary snacks, candies, sodas, and items high in refined carbohydrates like bread, pasta, cookies, and other flour-based products. The liver processes fructose in a way that is strikingly similar to alcohol, and an excess can drive fat deposition within the liver cells itself. Secondly, incorporating a wealth of specific nutrients can provide powerful support. Bitter and sulfur-rich foods are particularly beneficial. Leafy greens, artichokes, radishes, and cruciferous vegetables like broccoli, Brussels sprouts, cabbage, and kale are excellent choices. Foods such as garlic, onions, scallions, and mushrooms, along with high-quality proteins from pasture-raised eggs and wild-caught oily fish, provide sulfur compounds and other nutrients that boost the body's production of glutathione, a master antioxidant crucial for liver detoxification pathways. Walnuts are another valuable addition for their supportive role. Simple daily rituals can also make a substantial difference. Beginning the morning with a cup of organic coffee, for instance, has been associated with a lower risk of liver scarring.
Enhancing this further by adding a teaspoon of turmeric introduces curcumin, a phytochemical with potent anti-inflammatory properties that can aid in repairing liver tissue damaged by various factors, including fructose. Staying well hydrated with at least 1 liter of high-quality mineral water throughout the day is also essential. Proper hydration helps thin the blood, easing the liver's filtration workload, and supports the production of sufficient fluid bile to break down fatty deposits. For an added detoxification boost, a squeeze of fresh lemon or lime juice and water can stimulate bile production and enhance the liver's natural cleansing processes.